For me, formulating my civic project started with thinking about my home. The Bronx is a borough robust with community and culture. The Bronx is also the city's northernmost borough and is nestled between extreme wealth and debilitating poverty. Despite the Bronx's proximity to affluence of Manhattan and Westchester, 30% of its inhabitants live below the poverty line, and this has negative implications on their health. Here in this graphic, we can see that beside the differing boroughs, there's stark differences between life expectancy at birth. I also grappled with this idea here at WashU in my course, Introduction to Global Health and Environment. On the first day, we're a map outlining the differences in life expectancy throughout the city. And it's through that I realized that the same issues affecting my home also occur in St. Louis. The map displayed in lecture shows St. Louis divided into subsections, with the lines dividing the municipalities of St. Louis coming stark declines in life expectancy. 2 miles separates the affluent, predominantly white neighborhoods from poor, low-income neighborhoods. And with this, I decided that I wanted my civic summer to be focused on disparities in health outcomes for low-income communities of color. With my civic summer, I interned with IFM Community Medicine as an operational intern and as a clinical volunteer. IFM is a nonprofit that takes healthcare services directly to points of need in the community through overcoming access barriers related to cost, transportation, language, and trust. Every clinic exists through a collaborative partnership with schools, shelters, and other social service organizations. IFM operates in 18 clinic sites throughout the St. Louis metropolitan area and provides care to 3,000 patients annually. I volunteered at Hancock Clinic, located in South City, and serves a predominantly white, low-income population. It functions as a primary and preventative healthcare resource for students and their families, many of which fall below the poverty line and have unaddressed health issues. Through this, it breaks down the barriers to quality healthcare to bring care to patients of the most need. Additionally, I volunteered with Covenant House. Covenant House is an organization that provides support for homeless and transient youth. The majority of individuals served through this clinic are low-income people of color. By establishing clinics within the walls of an organization, IFM provides care in a cost-effective way, which reduces the barriers for those who otherwise have difficulty accessing the traditional health system. I learned that one of the biggest components to creating community-based care intervention is collaboration in order to reach the most amount of people possible. This is just one of the many facets that IFM goes through to make sure that they're reaching as many people as possible in the St. Louis area, and with that collaboration comes understanding the needs of these populations. Through this just shows another clinic which is also different in the ways that the spaces that are used to help patients change based on their needs and understanding what healthcare looks like for them. Another route that IFM takes is collaboration with funders, one being Mid-America Transplant, and they primarily fund IFM's Test Learn and Change initiative, which focuses on kidney health for many of the people who access Covenant House's clinic, again being low income, people of color, transient youth, and people who have just a hard time accessing the traditional healthcare system. Understanding the intersection of economic status, race, and health changes the way we look at the healthcare system and the work that needs to take place to mend it. Through my summer, I got to speak with people to learn about what they wanted from their healthcare providers. And I think the biggest thing I took away from this is that the role a healthcare provider plays is listening. And to make tangible change, we have to understand the wants and needs of the people that we're helping. I learned that for different populations, different factors play into how they navigate their healthcare system. Factors like trust, familiarity, access, all have impacts on the things we should do and the things that we have to be cognizant of. I believe that we can't make meaningful impact if we disregard the people who we're having conversation with. And we need to be at the table present and listening to those who are facing real life implications on their health. This is just a mural synthesizing Mid-America's transplant's approach to health. And this collage just kind of provided a tangible symbol of what my summer kind of grappled with, understanding that collaboration is a really big key in making sure that our healthcare system is working properly. I think that while the healthcare system is fractured and there's a lot of things to be mended for the most vulnerable populations, there are opportunities to make meaningful and tangible change. And this is a responsibility that all of us share. This is the entire IFM team over the summer, 3 of us being interns, 2 of us being the CFO and CEO, and I think that all of us share this responsibility, and while it seems like it's a big task, it's very much possible. Thank you.